David Amess.
The whole House was moved by the speech of my honourable friend for Wickham. Losing a child under such circumstances, the pain must be unimaginable. Turning to my honourable friend, the member for Thanet South, who started her speech by beating herself up on the basis that she didn't feel she had done enough to raise the profile of epilepsy. Nothing could be further from the truth. She has done a magnificent job. And frankly, she has made my day, because her invitation for colleagues to come up with ideas as to how she should break the law as an epileptic, I think when she gets back to her room later, she will find that she is inundated with suggestions. I, like others, am very sorry that she has chosen not to stand in the next election. I just hope to pray to God that she is replaced by someone with the good common sense and judgment which she has shown throughout her time as a member.
Yeah.
Epilepsy is potentially a life-threatening neurological condition, as everyone has said already, affecting the lives of nearly 500,000 people in England alone. It can reduce life expectancy by up to 10 years and can leave people unfit to work, as we've heard already. Among other consequences, epilepsy affects children's performance at school due to seizures. Nearly half of the number of deaths from epilepsy can be avoided, as we've heard already. So in the constituency I represent, there are estimated 865 people suffering from epilepsy, and this figure increases to 13,600 for the county of Essex. What are the local CCGs, Madam Deputy Speaker, however, doing to assist people with epilepsy in the area that I represent? I'm afraid to tell the House, just not enough. Clinical commissioning groups have a very important role to play. They have a strategic influence and make commissioning decisions that impact the lives of an average of 2,370 epilepsy sufferers in each CCG area. I have recently been in contact with Epilepsy Action, who I agree with other colleagues are doing a wonderful job in raising awareness of the problems faced by people with epilepsy. I was completely shocked to hear that my local Southend CCG has no plans to produce a written needs assessment of the health and social care needs for people with neurological conditions. No plans to produce a written needs assessment of the health and social care needs for people with epilepsy, not identified neurology or epilepsy as an improvement and saving opportunity, not identified neurology as a priority by the local health and wellbeing board, and not appointed a clinical lead for neurology. That simply is just not good enough. Southend West, Madam Deputy Speaker, has a higher than average number of people with epilepsy. I think it's because of its high ageing profile. The correct ratio of specialised epilepsy nurse to patient is 1 to 300. The specialist nurse at Southend Hospital is currently looking after more than 1,000 patients. Absolutely ridiculous. This has got to change, and there must be more specialist epilepsy nurse posts created before any improvements can be felt by local residents in the area that I represent. I fully accept that this is a country-wide problem, but it is very frustrating, the current situation, that most CCGs do not understand the needs of people with epilepsy. I am in regular contact with the South East Essex Epilepsy Group Support, superbly led by the chairman, Mrs. Diane Blake Lawson. It's a wonderful source of information and support for epilepsy sufferers in the area that I represent. And I hear about all sorts of obstacles faced by people with epilepsy. Very often, local residents are diagnosed, and then they and their families are left without any medical guidance or support. We've already heard a little bit about that earlier. I was particularly upset to hear that Southend Hospital has on a number of occasions refused MRI scans and other medical examinations. I have received complaints regarding prescription of generic drugs, despite evidence suggesting that the use of generic drugs leads to increased risk of seizures. Even more alarmingly, I was informed that latest drugs are not made available to patients as older and less effective drugs are cheaper to use. Again, this is just not acceptable. Local residents often get caught up in a confusing situation where the hospital says that they should speak to their GPs first, and once they contact their GPs, they face reluctance to give any advice and suggesting that patients turn to neurologists instead. There is clearly a lack of GP training in epilepsy. Nationally, only 20% of people with epilepsy refer to see a specialist being seen within the NICE recommended waiting time. Even worse, there is an 18% gap in treatment of epilepsy, meaning that 18% of people with epilepsy who could attain seizure freedom unnecessarily experience seizures due to a lack of appropriate treatment. The Honourable Member for Knowsley raised the issue of benefits. I wanted to touch on that because a number of people are adversely affected by the present situation. The process of claiming benefits can be lengthy and stressful, as we all know, which can in turn aggravate the psychological symptoms as well as the frequency and severity of seizures. What I'm most concerned about is the ability of benefit medical assessors, who are very rarely doctors, to recognise and appreciate the severity of epilepsy. In conclusion, Madam Deputy Speaker, think that there is a role for government to play. We need more funds to be invested in medical research to ensure that more people with epilepsy can access effective treatment. Southend residents, I think, suffering from epilepsy should not be denied access to the various treatments, as I said earlier. For too long, epilepsy has been forgotten in terms of funding and variety of treatments available. It is time for the government to hold CCGs to account to ensure that due gravity is given to this very serious subject. So, as my honourable friends hands the baton on to the honourable member for Walsall South, I hope that in the next Parliament, whoever forms the next government, we will do our very best to provide the highest treatment possible for those who suffer from epilepsy.
Yeah. Morris.